Another question that we hear a lot about is when patients are deemed to be borderline for a straightforward breast augmentation. So that means, can the patient have a straightforward breast augmentation with an implant and have a nice result, or do they need a breast lift? And a lot of patients are put off by the breast lift, which, for good reason. There's a lot more scarring. And the scarring is more conspicuous, so you can see it, as well as it's a bigger procedure. It also costs more money. The recovery is a little bit longer. And so the big thing is when patients come to see me and I see that they're a borderline candidate, what we do is I first assess what the patient's expectations are. So the big thing with the borderline is if you have a breast augmentation alone and you should be getting a breast lift, you can be left with a deformity. There's a couple of different ones. One's called a double bubble deformity. Another one is called waterfalling of the breast, where the breast tissue itself kind of hangs over the edge of the implant. Also, the nipples might not be centered on the breast implant if you don't do a lift, because the nipples don't get moved when you put just an implant in. They only get moved if you do a breast lift, and that's what gives you the extra scarring. And so what I do, I manage this consult, is I will show photos of both. So kind of the patient can get an idea of what I'm thinking in my head when I'm recommending either the breast augmentation or the breast lift. And so if a patient doesn't really care if their nipples are a little bit low on the implant, because it is covered by a bra, then to me that means maybe you just go ahead with the breast augmentation. You don't need to do the lift. But if I have a patient that comes in and says, no, absolutely not, my nipples need to be centered, I don't want them sitting low, then to me that means, you know what, you're going to be really unhappy with just the breast augmentation. We do need to consider the breast lift. And so when I show them pictures of patients who are borderline, who have had just an augmentation, I think that really clarifies for the patients which one they're going to go for. Because if they see those and they're like, well, those look fine, then I just know, you know what, then let's just do a breast augmentation. We don't need to, explore the lift. And then I think that's probably the biggest thing, because it can be hard for patients to know what to expect in terms of the look when they're borderline if they just go ahead with an implant. And then also other things come into play. For patients young and they haven't had kids yet, and they plan on having kids in the future, they're probably going to get more sad. And so for those patients, I say maybe we can try to avoid the lift for now, because you probably will need one in a few years after you have kids. And so it's a lot of different things that we talk about, but I think the consult's super important for the borderline patients and for patients to see photos and to know what the differences are in the look versus having just the implant alone and having the implant with the lift.